Hi students, welcome home to Mars. Today we'll continue with posterior triangle. Please watch my previous video for the boundaries of posterior triangle. Today we shall discuss about subdivisions of posterior triangle. Come back to this picture. This is posterior triangle which we discussed in the last class. This posterior triangle is divided by a key muscle over here. This muscle is inferior belly of omohyoid. This inferior belly of omohyoid divides the posterior triangle into, this is occipital triangle above. So this whole triangle is occipital triangle, and this small one, this is subclavian or supraclavicular triangle below. So this is subclavian or supraclavicular triangle below. The names are because of the presence of occipital artery in this triangle and subclavian artery in this triangle. In the previous class, we had already drawn the boundaries of the posterior triangle. So now we'll only draw the key muscle here which divides the posterior triangle into the two parts. So this is inferior belly of omohyoid. So this inferior belly of omohyoid divides the posterior triangle into occipital triangle above. We are going to discuss only of this triangle today. This is occipital triangle above and this is subclavian triangle below. Now, see the boundaries of occipital triangle alone. For the occipital triangle, anteriorly, it is bounded by posterior border of sternocleidomastoid. Posteriorly, it is bounded by anterior border of trapezius. Base is formed by the key muscle itself, that is inferior belly of omohyoid, and the apex is formed at the superior nuchal line where sternocleidomastoid and trapezius will meet. The floor is the same which we have seen in the boundaries of the posterior triangle, that is the semispinalis capitis, splenius capitis, the bulk is levator scapulae, then scalenus posterior and scalenus medius. The roof is by skin, superficial fascia and investing layer of deep cervical fascia. Coming to the contents, the most important content of the occipital triangle is spinal accessory nerve, which supplies both sternocleidomastoid and trapezius muscle. So this is spinal accessory nerve. This spinal accessory nerve further divides the occipital triangle into carefree triangle above. That means there are no important structures over here, and a very careful triangle below because there are very important structures over here. Surrounding the spinal accessory nerve, there are some cervical lymph nodes. So label this as cervical lymph nodes. So this, now just consider this pen as spinal accessory nerve and this tissue as investing layer of deep cervical fascia. Now this spinal accessory nerve lies immediately below the investing layer of deep cervical fascia like this. So whenever there is a procedure which involves the removal of these cervical lymph nodes, then care should be taken not to injure this spinal accessory nerve, because this spinal accessory nerve supplies trapezius muscle. And what is the function of trapezius muscle? It helps to shrug our shoulders. It helps to lift the upper limb above the head level, as in combing the hair. So if the spinal accessory nerve is injured, trapezius loses its motor nerve supply and patient will have difficulty to comb his or her hair. The other content of this occipital triangle is we have C3 and C4 cervical nerves. So we'll label here as C3 and C4 cervical nerves. These will supply trapezius and levator scapulae, but they are proprioceptive in function. That means they are responsible for position sense. We also have the other nerve, that is dorsal scapular nerve, which actually pierces the scalenus medius. So this is dorsal scapular nerve, which supplies rhomboids. This is dorsal scapular nerve. Then the very important, we have the upper trunk of brachial plexus. So somewhere here is the upper trunk of brachial plexus, which is the commonest trunk to be injured at Erb's point. So label this as upper trunk of brachial plexus. Upper trunk of brachial plexus. Then we have the cutaneous nerves, which we have also discussed in the roof in the previous class. That is, one is lesser occipital nerve. This is great auricular nerve. This is transverse cervical nerve, and this is the supraclavicular nerves. So these are the cutaneous nerves. Label this as lesser occipital with the root value of C2. This is great auricular nerve with a root value of C2, C3. This is transverse cervical nerve, and this is supraclavicular nerve. Supraclavicular nerves. Just two arteries as the content. One is occipital artery at the level of the apex. So this is occipital artery, and another one is transverse cervical artery. So this part is transverse cervical artery. It's a branch of thyrocervical trunk, which is a branch of subclavian artery. For exams, we can remember the contents of occipital triangle with a very simple mnemonic, that is, some clever boys like traveling, in which S stands for the very important content, spinal accessory nerve. C stands for the four cutaneous nerves, and also the C3, C4. B stands for brachial plexus, that's the upper trunk. L stands for the lymph nodes. So while removing these cervical lymph nodes, spinal accessory nerve can get injured. And T stands for transverse cervical artery, also with the vein. And you can just remember one more artery here, that is occipital artery. In the next class, we shall discuss about the contents of the subclavian triangle. Thanks for watching. Please share your valuable suggestions. This is Mars, where medicine meets meaning.